health-wise. I am your host, Dr. Monique Lescott, in collaboration with the St. Kitts Nevis Medical and Dental Association and ZIZ Broadcasting Corporation. We have a wonderful show all lined up for you guys this evening. This evening, I have with me Mr. Atik Samad. I would allow him to introduce himself later on, but we'll take a quick commercial break. Thank you.
Guess what? What? September 2024 marks the official start of Adherence.
And our government has a super cool gift just for us.
$1,000 in saving and investments.
$500 will be held in a savings account.
That will go as you go.
And $500 in shares.
Kept safely until you are qualified to access it.
And it belongs to us. Not mommy, no daddy.
And not only that, you'll be learning all about how to manage your money wisely at school too.
Yes, all children ages 5 to 18 who are citizens of St. Kitts and Nevis
And registered at a school, including homeschool, will qualify.
I can't wait for September 2024.
But I am the first group ever to benefit from this program.
Yay! To saving, investing, and
Watching our money grow.
And hello again. For those of you who have been with us from the beginning, welcome back. For those of you who are just joining, welcome. So again, I am your host, Dr. Monique Lescott, and we have a very interesting show lined up all for you guys this evening. Our topic for this evening will be the importance of medication adherence. And with me, I have a very knowledgeable person in that field, in that expertise. His name is Mr. Atik Samad. He is a well-known pharmacist around Bastille by now. So I will let him open up the floor. So, Mr. Samad, nice to have you.
Oh, thank you for having me. Good evening, viewers. My name is Atik Samad, and I am a pharmacist. I've been practicing here in St. Kitts for about 7 years now.
Awesome.
So yeah, so I think I would be well known. All right, so this is the current place of work, City Pharmacy. It is on Princess Street, just on the corner of Princess and 4th Street. So we'll be on the opposite side of Republic Bank. There it is. We do everything from prescription medication, patient counseling, general OTC. We also do something we call digital doctor consultation, where if possible, and if the illness that you complain about doesn't require a physical examination from the doctor, we could get you connected via phone and they would send a prescription via email. So it's an e-medicine kind of setup that we do, and I believe that we may be one of the very few pharmacies that offer the service.
I don't know of any other ones. You'll have to elaborate on this one for me. So this, I really love this. That's a step in the right direction.
Right. So there is a need in St. Kitts that the doctor's visits are very hard to get into, especially in the private sector or even in the public sector, because there are long lines, long waits.
Long wait. Mm-hmm.
Yeah, and a lot of doctors, especially specialist doctors, would be booked up for weeks, sometimes
for months.
Right. So we've partnered with a few doctors, and we've got a team that we could call depending on what the complaints are.
I really, really love that.
Right.
I can't
So
stress how much I really appreciate that service. I'm not sure if other pharmacies do this, but I think that's very unique service that you're offering, and so I would like to commend you for that, because that's a very innovative step in the right direction. When I was studying, that's something that's done to help with the traffic, especially persons who they're
like-
regulars. Like for instance, we already
Right.
know what their condition is. It
Right,
might
so
be
like forget a repeat, and
Yeah.
you don't need to order labs or see the patient physically to conduct any kind of examination, then it is easy. Or for minor ailments, rather than you have somebody go to the emergency department, wait for a few hours, and then it's something that you just treat with over-the-counter NSAIDs or something like that, we could do it over the phone. Now, if the doctor feels the need to, we could always schedule an appointment. If it is something that we can't treat over the phone, we could schedule an appointment and then you would go in and physically see the doctor. But if it is something that we could do over the phone, they would just email us the prescription.
I think that's the most
we'll get you your
convenient thing,
medication.
especially for persons who might not be mobile,
Right.
especially elderly persons. They might have a caretaker, but being mobile to come all the way to town or even to sometimes their local health center in their area sometimes is a challenge for some of them. So if a caretaker can just make a phone call just to be on the safe side and to make sure that the person is in the right order in terms of their prescriptions, I really love that. I can't say it enough. So we'll go right into the program. So the topic for this evening is the importance of medication adherence. We take that for granted, but it's a very much as you said, it's an international problem. We were speaking before, so you can elaborate.
Right. So you were asking me if this is a problem that is unique to St. Kitts, and I was saying no, it isn't. So before we dive into what is like the problems with medication adherence, let's just define what is medication adherence, then talk about some chronic illnesses, and then we'll go into what are the problem areas or what are the challenges that people face that cause them to be not adherent. Okay, so medication adherence. So this is taking the prescribed medication as prescribed at least 80% of the time. So if you miss a dose or you miss a few doses, that is fine, as long as you are adherent for 80% of the time.
Yes.
Okay, so you don't need to be 100%. We are all human. We make mistakes.
Yes.
We may forget. Our busy schedules may not allow. So there are challenges. Okay, right? And our focus today is medication adherence in chronic illnesses. So people who have lifetime disorders that they need.
Non-communicables.
Right. So I didn't want to focus on just NCDs because you would have seen the program with
Yes.
Dr. Drew and
Yes.
said that now is the time to focus on NCDs. But I did not want to overlook other illnesses that are chronic but that don't fall within the spectrum of NCDs, such as HIV. So
That's not an it's communicable. Yes.
Right,
Yes,
so it's
yes.
sexually transmitted
Yes.
disease. So it is communicable. So it doesn't fall within the definition of an NCD, which is a non-communicable disease. But it is a chronic illness.
Yes.
Once you contracted HIV,
Yes.
you will be dealing with the consequences.
And the medication is for a lifetime
And the
afterwards.
medication.
So it's
Right.
chronic for sure.
And it becomes very difficult over time to manage. Right? And then you get non-compliance. So I didn't, especially in regards to, there has been an increase in the number of HIV cases within the younger population. So I didn't want to skip HIV. And
I
just
got you.
focus on the
Definitely, that's a
NCDs.
very pertinent topic too. Definitely, we need to spread the word.
Right. So some of the chronic diseases that people, well, in the Federation, the more common ones would be like high blood pressure, heart disease, hyperlipidemia, which is high cholesterol, depression. Yeah, there's a lot of people with depression and other mental issues, eczema and other skin disorders.
I forgot about dermatology.
Right. So there's like eczema is something that people will deal with all
Yes, it's
through
chronic
their
because
life.
some of them, they're born with it most
Right.
times, right?
Right, and treatment is very expensive as you go on because you need a lot of corticosteroids, either topically or even systemically. So a chronic disease is something that is long term, and we are going to zoom in a bit more on NCDs as we go along because that's the most prevalent of the diseases that we face. But I did not want to overlook things like asthma, HIV, eczema.
Asthma is another that's another chronic one for
Right.
sure. And
When
a lot of Caribbean persons.
Right, and when people just mention NCD, they just think blood pressure, heart disease, diabetes.
The regular stuff.
Right, and it's just limited to that. But there's so many things that come under chronic illnesses. That's why we word it as chronic illnesses and not just NCDs.
We're going to stick a thumbnail because we are due to have a commercial break. And when we come back, we will definitely dive even deeper into the topic. I'll see you when we get back.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
And welcome back to those of you who were with us before, and welcome to the ones that are just joining. We were just getting into the crux of the topic before the commercial break, so we're going to do a nosedive even deeper into the matter. We were speaking about chronic illnesses as it pertains to the adherence of medication taken and not necessarily the non-communicable chronic diseases. We have a lot of other chronic diseases that are not non-communicable. So I'll let you take the floor again.
Right. So before we left, we were going to dive into it. So more people are inclined to take in medication for short-term illnesses or illnesses whose signs and symptoms are very physical or prevalent. Like if someone has a cold and then they can't function in their everyday activities,
then it will be force them to take the medication.
So they are so desperate to get back to normal that they are very adherent to anything that you would prescribe or anything that you give them over the counter. But in long-term illnesses, especially with NCDs, where the signs and the symptoms aren't felt, where you feel like you're taking medication for an invisible illness.
And it's like they're not seeing the
effects.
Yes.
Right. And in a lot of the cases, what happens is that they start feeling the side effects of the medication and not know if it's working or not. Because the symptoms that we are treating are largely invisible, like such in high blood pressure. High blood pressure is what we refer to as a silent killer because there are no signs or symptoms. Yeah, a lot of people would feel like, okay, if I have this dull headache in the back of my head, my blood pressure is high. But then if we do test their blood pressure, it is normal, and sometimes the headache is just stress. Or sometimes a lot of people need glasses or need their glasses changed.
Or probably just didn't eat.
Yeah, a lot of the times it's low blood sugar rates, it's a hunger headache, or it's the nerves of the eye that pull in, so it kind of gives you this nerve headache.
Pain.
Right. So going back to chronic illnesses, and this is one of the reasons why people are non-adherent, because they feel like they're taking a medication for something that really doesn't affect them because they don't feel the effects.
But they're going to feel the effects of the side effects of the medication. So now the medication becomes the enemy.
Right, right.
I understand.
Right. So, okay, so before we dive into all of it, let's just go to slide 5. I wanted to briefly speak a bit about acute infections and short-term prescribed medication. Now, it is important to stay adherent to short-term prescribed medication just as it is for long-term medication, sometimes even more so, because in the cases of antibiotics, people are prescribed antibiotics for a set duration of time. So here's a common scenario. Your healthcare provider, your doctor, gives you a 10-day course of antibiotics for a bacterial throat infection. Yeah, so you have an upper respiratory tract infection. But by day 5, you start feeling good. Yeah, everything went away, all the signs and symptoms are gone.
So you feel like you don't need to continue the rest of the course of the medication.
Especially if you see side effects, right? Especially with some antibiotics, you may get a lot of stomach issues.
Maybe some diarrhea and stuff.
Right, because antibiotics kill the normal
flora of the gut.
Bacteria in the gut that helps with digestion. So a lot of people would get digestive issues. So they will be more inclined to discontinue, especially since they start feeling better. But what happens is slowly the illness would start coming back. And sometimes what happens is
it's going to come back stronger.
It comes back stronger. What happens is that the bacteria would now be immune to
that round of treatment.
Right, and if this happens enough, we would end up with what we call a super infection. And super infections are very hard to treat with a normal course of antibiotics.
They might need something systemic now. They might have to go to IV.
Right, you would need something very strong. So the only time you should discontinue antibiotics is if you have an allergic reaction. And that wouldn't happen after 5 days. That would happen
as
immediately.
Soon as, yeah.
Now, signs of an allergic reaction would be like you see swelling in the face, the lips, the tongue, difficulty breathing. If you see any of those when you take any medication, not just antibiotics, you could stop those immediately. You contact your prescriber, you discuss what happened, or you go to the emergency room because a lot of the time you would need a shot of epi. Right, but that is the only time. Now, if the side effects of the medication are overwhelming, you can speak to your doctor and switch to something else. Right, so it's an open line of communication, or it should be, between the patient and the prescriber. So, if you encounter any difficulty, just you can speak to your pharmacist.
Sometimes when I try to explain to persons the way how antibiotics work, I don't think they understand, and I don't think they understand the evolution of antibiotics. I think the first antibiotics known to medicine was penicillin.
Right.
And then thereafter, they keep having to add stuff to the penicillin to strengthen it. So then we have first, second, and third generations of antibiotics. So then you have the first set would have been the first ever penicillin. And so when you have to add something else to the penicillin to make it stronger, then this is second. So then I don't think people realize that they become resistant to the medication. And then
the bacteria itself would evolve. So bacteria mutates, it becomes adapted towards the medication.
It's like it has a life of its own.
Well, it is a living organism.
I understand.
And the thing is, they multiply quickly, and each time they multiply, they can evolve.
Mutate. So then that's why it's important to take the antibiotics straight to the end of the prescription term. If it's for 2 weeks, 14 days, don't just take 10 days worth of the medication, because you're going to run the risk of making yourself even more sick in the future. And you might have to get even stronger prescribed medications. So if the problem was that you were having diarrhea and upset stomach, when you have to be prescribed now stronger medications, then your side effects will increase also. So it would behove everyone to just adhere, which I know sometimes is not easy for everyone. Some persons explain to me they have, what's that, dysphagia? They have trouble swallowing. They don't like swallowing tablets and stuff.
So in most cases, unless your tablet is coated or a capsule, it could be delivered crushed. But read the labels. There are usually labels within the box, or you could ask the pharmacist and they will tell you how. A lot of the time, especially if we're giving it to children, you can crush them and you could mix them into juice or some jams.
I was just about to ask, but not orange juice, right?
Some medication may interact with
orange. You have to know which juice you can, which is a good juice.
So
apple?
Yeah, apple juice is fine. Anything that your child like that isn't, see, the vitamin C, the ascorbic acid in the orange juice might be the cause of the problem. So any other neutral juice would be fine.
Gotcha.
Gotcha. Okay, so the other important thing, I want people to understand what happens when you consume a tablet. So if we can go to slide 6.
That's the therapeutic window where we
Right.
discuss the half-life of the medication and
Right,
whatnot.
right. But we won't get too much into the half-life and how you calculate. I just want everybody to have a broad idea of what happens when you take medication. So if you look at the chart, at 0, 0, that means there is 0 amount of the drug
In
in
your
the
system.
system, and you haven't taken it right. So from that point on, once you ingest the tablet, the plasma concentration of the medication starts to go up. Right now, at this point, until the plasma concentration reaches a point where it can produce a systemic therapeutic response, which is the desired response, that area is called subtherapeutic dose. So even though the medication is in the system, it is not
enough.
right? It's not doing what we want it to do. So that's the subtherapeutic value, right? Now, once it starts getting to where the peak is going into the green, that is where we have our desired response. This is the therapeutic window. Now, it will reach the peak of its effect and then it will start coming down, right? Now, when it starts coming down, now, during this entire duration of time, you can have side effects. It can have side effects in the subtherapeutic part.
Because by that time, it's already gone to the bloodstream now.
Right.
Gone through the system.
Right. So, can we go over to the next slide? So this is what happens when you take multiple doses. So the green is where we want to be. Right, so this is why we end up taking multiple doses at different times. Now, different medication have different half-lives, as you were talking about, and half-lives is the amount of time that the medication would take to dissolve into half of the original value. Right? Now, why we give several doses of a medication is because we are trying to keep it within the green window. You see the green window? That is the therapeutic window. Now, if you miss your medication dose, it will dip into an ineffective part of the chart. So the medication is in the bloodstream.
Yeah, but it's not effective.
Right, but it's not effective,
enough. It's not
even
enough
though
to
you're taking medication. So if you don't take your medication on time, that is what will happen. It would always stay within what we call the subtherapeutic dose. Now, conversely, if you take your medication, let's say you miss a dose and then you decide to take two doses.
Double up, oh no.
Right? So this is where you will go above the therapeutic window.
It's toxic.
And go into the toxic. Right. There's even another level above toxic, which is fatal.
I was about to say, above toxic sounds like a poison.
Right, so there is a fatal dose for most medication.
Okay.
But that's where you really overdose, and as long as you don't abuse medication, you won't get to the point. But a lot of the time, when you see these celebrities that OD'd, that overdosed on those controlled substances, they went subtherapeutic, therapeutic, toxic, fatal.
So as a pharmacist, being in St. Kitts practicing, I was shocked to find that we don't have a lot of the medications that you would find. So like I thought Percocets was something that was pretty popular or common, but I'm not sure. Like I'm just saying as an example, there are a lot of medications you might get if you go to an overseas facility. They would treat your pain, and sometimes they would give you medications that you cannot refill here in St. Kitts.
Right. So we are a smaller island with a smaller population, and we have a smaller buying power. And for certain medication, especially medication that are more popular, we simply do not command enough of a demand at times, or sometimes we simply can't afford it, or other countries maybe, I don't want to say other people get preference because that's not necessarily true, but what happens is that as a smaller island, you are limited in what you can do. And then, like if the public sector doesn't carry it, it's very hard
to get
for the private sector to do so. And even when we do, the recommendations aren't enough to qualify, like because suppliers would have a basic, a low amount that you can buy. Like I can't go and buy 3 or 6 of a particular.
Oh, you have
treatment.
a minimum amount that you can buy, and then you have to be careful with the expiration. And yeah, you're gonna end up with dead stock.
And we don't have enough people on the medication, and the persons who are using it don't use it quite
Regular enough.
right, to validate you going to make this investment. So then from a business point of view, as sad as it is, that you could, because you would want to offer this to your patients, but you simply can't because...
You know, I'm glad you cleared that up, because I was about to be offended that we don't have what other persons have access to. I was wondering if we were being discriminated against. But.
No, and then a lot of pharmacies, mine included, would make provisions. Like, we can do special orders if the patient is willing to take on the
risk.
Yeah,
okay.
The risk and the cost of the medication. And a lot of other pharmacies, even we, in some cases, depending on the cost of the medication, would ask for some sort of deposit to secure the medication.
I got you.
But
that
special orders are something that is being done, not just by me, but by other pharmacies as well.
I don't think the public knows that, because I didn't know. Sometimes if I go to get a particular medication and they say, well, they don't carry it, I guess in the back of my mind, I just give up. Like, it wouldn't cross my mind to ask them if I can have a specialty order done just for me, or you know. So
this is where I was going back to where I said that we should have a relationship, a two-way relationship between prescriber patient, dispenser and patient. You need to have the relationship with the medical professional so that you can ensure the best possible outcomes for yourself. So speak to your pharmacist, speak to your doctor. Like, if you have questions, feel free to ask them. They are there to answer those questions and concerns. And anytime you run into any kind of issue, especially with medication, if you have difficulty being adherent to your medication, if you have difficulty with the side effects of the medication.
Yeah, so that you can have the options to, you know.
Because a lot of the time, like in blood pressure, or for instance, diabetes, there are different classes of drugs that we can treat with, and some of them respond better with some individuals, and some of them work better with other individuals. So we can switch between classes even within like blood pressure medication, because you have your beta blockers, you have your diuretics, you have your ACE inhibitors, you have your ARBs,
and the PPIs.
Right. Well,
that's not for high blood pressure, but I figure like those ones can also.
So here we go. So this is an example of a diuretic, right? So benzoflumethiazide, better known as Bezide by the public. So this is a diuretic, and it is commonly used to treat high blood pressure. So this works by getting fluid out of the body, and with fluid goes sodium. And sodium is like a vasoconstrictor, makes the blood vessels harder. Right?
So you're going to end up with calcification after a while, no?
Yeah, after a while.
We're going to stick a thumbnail, because we have to go on commercial break. We have to pay these bills. We'll be back shortly after a quick word with our sponsors.
We never know when a storm may strike, but we can be prepared. At Skelec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. After the storm, our response teams will assess the damage to our network. If you are daring enough to go outside after the storm has passed, don't touch any downed power lines and stay clear of sparking wires. We'll need you to remain patient, as some restoration work may take longer than others. Before restoration work begins, we will fix any damage to our power plant and transmission lines. Then we'll restore power to priority areas, beginning with essential services like hospitals, police stations, and water pumps. After that, we'll restore power to the largest number of customers on one feeder, which will take the shortest amount of time. We will then restore power to smaller feeders and individual customers with isolated problems. Be sure not to worry. Skelec is right here with you when you need us most.
And welcome back. For those of you who have been here before, welcome back. And those of you who are just joining, welcome. Our topic for this evening is the importance of medication adherence, and I have with me my guest, Mr. Atik Sama. He is an entrepreneur and pharmacist working in the Federation for the past few years now. He has his own pharmacy in town, and so he is very well versed on these matters, and we have invited him here to share a quick word of knowledge and advice to the public. So we are going to continue with our discussion and our elaboration of what we are discussing here earlier.
Great. So we went through therapeutic window and subtherapeutic and toxic. So now that so we know now why it is important to take your medication and why it is important to take them on time or relatively within the window, so that we could keep it in the therapeutic at the therapeutic level. So let's deal with what are some difficulties that people may encounter when taking their medication, some of the reasons for non-adherence, right? So the World Health Organization says that there's basically 5 categories that you could break these down into. That is too complicated because they go into like the patient and the patient's like their mental well-being, their schedule. They're not seeing it as something as important because the disease is asymptomatic. But I think we could just go into more relatively relatable reasons. So those are the ones that are on screen. So people may forget. You might be out and about.
That's true.
You come home late, you're tired, you forget. Yeah? People may not be convinced of the medication's effectiveness. This is something that is very, very, very problematic in St. Kitts, and not just St. Kitts, but in the Caribbean and in Guyana.
There's a distrust. There's a distrust for that sort of thing.
And I can't really blame people for distrust. They're big pharma. Medication companies are for-profit companies. A lot of the times you would find that, they move that they make are based on profit, not necessarily patient.
Not wellness.
Right. So I understand. However, with chronic illnesses, you would not taking the medication would put you at risk for not living your best life.
Of course.
Right? Because you won't be able to do things that you should be able to do, depending on what the condition is. So your quality of life now decreases because of your distrust.
Oh, yes.
Right? Now, if you take a medication and you're having side effects, which is the next point, then that's something that we can discuss with the healthcare provider, and we can switch it to something with less side effects. For instance, in blood pressure medication, the ACE inhibitors, the way that those work is the angiotensin converting enzyme that it inhibits after it does step.
Hey, we have to break down this. This is a lot of medical jargon that you just went into. Okay. The angiotensin. We have to explain to persons what the angiotensin system is.
So there's the renin-angiotensin aldosterone system. There's an easy way to.
That's for your renal system.
Right.
Yeah. So then that's the way how your body metabolizes.
That's where the medication works.
Yes.
Right. So angiotensin is a vasoconstrictor. So inhibiting it. So when we inhibit it, it won't be able to constrict the walls of the blood vessels.
So then it's going to make the vessels
relax or expand, and that would release pressure.
And it would also lower the pressure, right?
And it would lower the blood pressure.
Yes.
Now, when it does this, there's a buildup of something that causes a dry cough. So the medication's main side effect is a dry cough, especially with the first generations and like the captopril, right? Here we use a lot of lisinopril, and it has the same side effect, right? So some people may find it bearable. Some people might be like, okay, so this cough isn't as bad, as, we can live with it. Can we
just prescribe something to just moisten the throat?
Right, we can, but then you get into But instead of treating, we could switch them to something else that might be better for them in terms of that. rather than just mounting one drug onto another drug to treat the side effects of that drug, and then you have polypharmacy and you end up with 13 things.
That's true.
Right? I'm not saying that that isn't a route that you can go from the prescriber point of view. If lisinopril is the preferred drug for manage this person's blood pressure, and the coughing isn't that bad, and adding a cough syrup would help, fine. Right? That is at the prescriber's discretion, right? But you have to keep in mind that for chronic illness, they have to be taking the medication for the rest of their life. And nobody would want to take a cough syrup for the rest of their life. Yeah?
But we have a slide here, the chronic diseases, the examples of, I guess we can run through that later on so that persons can know.
We did?
Yeah. Because I didn't realize that cystic fibrosis would have come under the chronic disease category. For some reason, that slipped me. Yeah. Okay, interesting.
So some forms treatable.
Okay, I understand.
But the thing is, so as long as it isn't acute, it would be chronic. So as long as it goes past a certain point, it is termed as chronic. And a lot of the times we don't realize that these things are chronic because our focus sometimes is just NCDs, the non-communicable diseases.
That's true.
But these people live with these illnesses for a prolonged period of time, and it affects their quality of life, it affects their everyday activities. Like in the case of cystic fibrosis, people may want children, it affects their personal lives. So it is a chronic problem that they would have to deal with.
Do you see a good amount of cases of the COPD?
Yeah, St. Kitts does have a lot of COPD.
I don't think persons realize that, and I don't even think that it's a term that we come across too regular in our regular speech. We would hear about asthma, we hear about diabetes, but I know the COPD is becoming one of those on the rise. Yeah,
it's one of those emerging illnesses that we've been dealing with here in St. Kitts. And the thing is, lately, as education goes on and people become more sensitized and more people realize that this particular thing that is affecting me might be a disease, and then they go and get treated, we will start seeing more and more cases. But before, we just treat a cough as a cough, and we moved on, and we didn't know that there were underlying issues there.
Oh, I got you. So for clarity, the COPD stands for chronic obstructive pulmonary disease. So it can be classified as some persons might have shortness of breath. Like it can overlap with other symptoms and you might not know. You would have to be diagnosed in order to classify what goes where. So that's why I wanted to point out that COPD is something that we need to be looking out for in these times because I'm noticing it.
Great. And then do we have like a spirometry department at JNF?
Yes and no, we do. So we would, especially if a child, let's say for instance, example, we suspect asthma. There are diagnostic tools to use so that we can know exactly what we're working with. As far as I know, I think we used to have an asthma clinic. Don't quote me, I will have to make sure that it's still so.
Okay, for the viewers at home, spirometry basically deals with lung conditions.
Your lung function. You have to blow through a tube, and then it would judge the forcefulness of your breath or something. Right.
It tests the lung capacity.
Yes.
Right. But I didn't think we had a spirometrist, like a specialist in that particular field. I
swore we had a case, but that's why I said don't quote me because I can remember. But let me follow up. I don't want to get into any problems.
Yeah, no problem. So let's move on. Let's jump.
Actually, we're going to have one more commercial. Not one more. We're gonna go to commercial break because we have to pay these bills.
Yeah, no problem.
And we'll be right back.
Okay.
It's time that we realize that we must work together to thrive. Our lives we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
And welcome back to my guests who have joined us since the beginning. And for those who are just tuning in, welcome. And our topic for this evening is the importance of medication adherence. And I have with me as a guest Mr. Atiq Samad, who is a very knowledgeable pharmacist and business person in the Federation for the last few years. So he's come to our show to basically let us know, to elaborate on the topic of the importance of medication adherence. So I would, again, hand the floor over to him to elaborate.
Okay, great. So we were last talking about the multi-dimensional reasons for non-adherence and all the challenges that people may face. So we spoke about side effects. We spoke about the fact that the symptoms are invisible, so people don't feel it. So we spoke about distrust in pharmaceutical companies, big pharma, as we put it. Other things that may stand in the way, especially for our situation, is the cost. Like medication costs money, especially when you start going into advanced
treatments,
and advanced stages of disease, and you would quickly realize that especially when you have to buy a medication on a monthly basis, it becomes very, very, very expensive. Certain medications like Eliquis.
Eliquis is extremely expensive.
Right, Pradaxa, those things are $200-300 a month.
Yeah, and sometimes US too.
They can become very, very cost inhibitive to especially a regular person. So how do we deal with this? Like, what do you do if you go to the pharmacy and you find out that the medication that you need is something that you can't afford? What are your next steps? In a lot of cases, generics are available. So if you are in the pharmacy and your medication comes up to an amount that you may not be able to afford, ask the pharmacist for generic substitutions that may be cheaper. They may not be available in every instance, but that is an area that you can explore. A lot of the times, I believe you could get medication from the public sector at...
Can I ask a quick question? So the generics, how much of a less of a cost? Is it like half the amount?
Well, it varies. It really does. So it could be anywhere between 30% of the cost to 50%.
Wow.
It could even be more or less than that. It really depends on the drug. Like if we were to take Lipitor, the generic in the 10 milligrams may be like $1, somewhere around there, depending on where you go. It might be a bit less, might be a bit more, but the brand Lipitor itself in the same one might be 3 times as expensive. But there we are.
So then what's the scientific name for Lipitor? Because the Lipitor would be the brand, but
right.
The generic name is what now?
So the generic drug name would be atorvastatin. You would see it right under the brand name.
So that persons can understand, because this is like a medical jargon. For instance, acetaminophen would be Panamol, paracetamol. So sometimes the names is the brand of the drug, but there's a generic of that same drug, and
Right.
you can get it cheaper.
Right, and most of the time, well, all of the time, it is the same drug at the same strength, and it will work in the same way.
You're just not paying for the name brand price.
Right, you're just not paying. And the thing is, the name brands, they are expensive for a reason. The companies that produce the brand, they have the patent on the medication. They were the ones that did all of the research and development of the drug.
Oh, they did the study.
Right, so to recoup their costs,
They
they
have
sell
to-
it at, yeah.
So then where do the generics come from? From knockoff?
Okay, no. So what happens is when the patents expire, when the company patents expire, so after you develop the drug, the FDA will tell you, okay, you can sell this for this amount of years as the brand name, and we won't let anybody else manufacture it, and we will give you the time period to recoup your
So you basically
development
have the
cost.
monopoly until you're able to.
Right. And when the patent expires, you have to then release the recipe for the drug to other companies, and then they would make them available.
See, that's interesting. I don't think the wider public knows
Right.
this.
So it is essentially the same drug, same strength, and largely with the same excipients. So it should work in the same way. And plus or minus some amount of efficacy and potency depending on which company makes it, which part of the world it comes from, and whatever development process they use. There is some differences there within the manufacturing, but it has to fall within a certain scope. And the scope will allow it to work largely in the same way. So you don't
Gotcha.
need to worry. All right?
Okay.
So that is that. So I wanted to give some tips on how to be adherent. Now that we know how chronic illnesses work, we know how medication work, we know why we need to be adherent, I want to give some tips on how we can do that. Now, set a daily reminder on your phone. Like everybody has their phone on them largely like 80-90% of the time during the day. Right? So if you can set an alarm that just says take medication, especially in cases where you're taking multiple medications at multiple times of the day, just set an alarm, and then when it goes off, you check your phone and be like, okay, now it is time for my medication. Right? There are apps available.
Really?
Yeah.
Do you have any examples for people to search?
I don't, but you can just Google them, and it depends too, because Android apps would be different from iPhone apps. So just check your particular store, whether you're on a Google store or the App Store on Apple. There are lots of them. A lot of them are free. They may come with some ads and some other bloatware, but they would largely work for your purposes because it's just a reminder. Right? And they might be a bit better than an alarm or easier to work with than an alarm. Right? Because you might be able to put in which medication you need to take, especially in cases where you take more than one medication, so you don't get mixed up and then accidentally take multiple doses.
Oh dear.
Right? And then you end up in toxic levels that we spoke about earlier.
Quick question though. So in the event someone goes into the toxic part of taking these medications, they go to the emergency room, what do you think would be, what's going to be done to them? They're going to have to get their stomach pumped. What are they going to do to get that medication back to a therapeutic level in the body? How you get it out of your system?
Well, it depends on the type of medication that it is. Some medication, not much intervention is needed.
You just wait until it
you
passes
just give it
out.
some time. Other medication depends on what the toxicity causes. It may require a bit more. It really up to the doctors at emergency to assess the situation. It might be a drug that requires more, but your levels hasn't reached a point where it needs to have some kind of intervention. So it really depends on the team at the emergency and what they see fit as the best possible thing. But for your purposes, if you think you take multiple doses and you're not feeling well, or you're seeing any of those allergic reactions that we spoke about earlier, if you see swelling of the tongue, face, lips, or anything like that, then you try to get to the emergency room
as soon as possible. Yes.
Right.
We're going to take another short commercial break, but after the break, we're going to definitely go into some health news with Dr. Jensen Morton before the commercial break, and then we'll go straight into commercials. So we're going to have Dr. Jensen Morton now, and I know he's going to have some interesting tidbits to share with you guys.
I'm Dr. Jensen Morton, the Director of Health Institutions, and today we're here at the back of the hospital to give everyone a very important update. We would have commenced construction of the new MRI facility for the Joseph and Franz General Hospital to serve the people of St. Kitts and Nevis earlier this year in March, April. But we're pleased to announce that we have reached a pretty far way, and the building is scheduled to be completed by the end of the year this year, and we're hoping to have its operations by the first quarter of 2025. So we are very excited for this news. We're very excited to soon be able to provide the people of St. Kitts and Nevis with the long promised and much awaited MRI facility, and we just hope that everyone continues to bear with us as we ensure that we perfect the process. So,
We never know when a storm may strike, but we can be prepared. At Skelec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. We monitor the storm and work closely with the authorities. We'll need you to ensure that there are no trees in the lines near you. If you need our help, call us for more information. It is likely that there will be a power outage, so make sure all your devices are fully charged. If you have a generator, make sure the changeover switch works. Ensure you have enough fuel and that your generator is isolated from the grid. It's best that you power off your main switch from the electrical panel and unplug all appliances. When calling to report faults, tell us everything. Don't leave any information out. After the storm, our response teams will assess the damage to our network. Be sure not to worry. Skelec is right here with you when you need us most.
Guess what? What? September 2024 marks the official start of Aspire.
And our government has a super cool gift just for us.
$1,000 in saving and investments.
$500 will be held in a savings account.
That we go. As you go.
And $500 in shares.
Kept safely until you are qualified to access it.
And it belongs to us. Not mommy, no daddy.
And not only that, you'll be learning all about how to manage your money wisely at school too.
Yes, all children ages 5 to 18 who are citizens of St. Kitts and Nevis
And registered at a school, including homeschool, will qualify.
I can't wait for September 2024.
But I yearn the first group ever to benefit from this program.
Yay! To saving, investing, and
watching our money grow.
And welcome back for my returning viewers, and welcome to those of you who are just joining. I have with me Mr. Atik Samad. Our topic for this evening is medication adherence. And so I'm going to let Mr. Atik take the floor, and we're going to wrap up.
Oh, great. So we were giving you tips on how to be adherent. We went through the first two. So other things that you can do to make sure that you take your medication is, one, you could get a pill organizer. You know those little pill boxes with Monday, Tuesday, Wednesday. So they have the days of the week. You just put your pills in it, and then you know when you look at it, okay, today is Tuesday. Tuesday's empty. I had Tuesday's medication.
That's true.
Right? If you take multiple doses, there are those that say morning, noon, or they got some that say breakfast, lunch, dinner.
And you can order those off of Amazon, right?
Yeah, and we sell them. You would find them at most of the pharmacies in the Federation, and they are relatively inexpensive. They aren't, they are $10, $20, depending on where you go and what kind you get, right? But largely, it would be less than $20, $25, right?
Gotcha.
and they are a huge help. Right? Especially if you get the ones that got the multiple doses a day and you take medication twice a day or 3 times a day, you just pop them in at the start of the week and then you know for the rest of the week that
you're good.
Right? You don't have to risk being subtherapeutic or in toxic levels.
I have to ask you this though before we go on. When it comes to males and females, who has the highest percent of non-compliance? I'm gonna
like you don't need to continue the question. Right,
I was being naughty.
So not just non-compliance, males are more
not trusting of the system at all.
Yeah, but then there's this thing with masculinity where you don't want to go to the doctor until or unless it is extremely overbearing.
Unless you're knocking on death's door.
Yeah, and a lot of the time, like, I would advise against it. Like, just as soon as you feel something a bit off, if you don't feel like you need a doctor, you could go to the local pharmacy and
ask a question.
To them, right? Like, look, I've been feeling this and this and this. And if it is something that can be treated over the counter, you can just pick something up and it would take 10 minutes of your time. And at least you would have the peace of mind that whatever it is, you didn't need a doctor. If it is something that we can't diagnose, well, we don't do diagnosis at the pharmacy, but it is something that would need a bit more than we can offer.
Then you will refer.
Then we would tell you where to go that you could get your help. But don't wait until it becomes overbearing. Okay. All right. So another tip is make your medication a part of your daily routine. Like you could take them with your breakfast or when you wake up or just before you go to bed if it's something that you need to take at night. Eye drops. Like for those people with glaucoma, right? You could you could set them up like that where you make them a part of your daily routine. So when you didn't do them, that you would feel something missing. You would feel like
like something off. You forgot to do something
that I needed to do.
I agree.
All right, so now let's recap.
Yes. So basically, what is medication adherence?
So someone that takes their medication at least 80% of the time. There is some space there for, if we forget or whatever.
And if it's less than 80%, you're non-compliant.
Yeah, you're non-compliant, you're not adherent, you may fall into subtherapeutic doses, you may end up spending money and time and medication and not getting the result that you wanted.
And not just that, what I realized when you don't take the medication, it changes the pathogenesis of the disease itself. The disease is acting one way under the compliance of the medication and you start being delinquent and you see that the disease now becomes more difficult to manage and to be under control.
Right. And that's when you may end up with more, you would need more than one drug for one particular condition. Like when we treat high blood pressure, sometimes we have to give them a beta blocker and a diuretic and something else. Anyways, moving on. Chronic diseases, we discussed, those are diseases that we have to live for a prolonged period of time. They would affect daily life for the rest of your life, so you want to make sure that you manage them well so you can have the best quality of life as you age and you are able to do the things that you want to do. Spend time with the people that you want to spend with. All right. We discussed the therapeutic window and challenges.
Yes. So it was a very packed session and I'm very grateful for Mr. Atik Salmon for coming and bestowing us with his expertise on the matter. But I'm sad that it's time for us to wrap up this segment and the show. So until next time, thanks for spending your time with us, your Monday evening, and we appreciate you. Have a blessed evening.